Imagine sitting in the dental chair. You hear the instruments. You see the forceps. Your heart starts racing, and suddenly you're thinking, is this going to hurt? What if something goes wrong? Am I about to lose a piece of my jaw? Trust me, almost everyone feels that way before their first tooth extraction. But here's the funny part. Most people are scared of the wrong things. Today, I'm sharing everything I wish I had known before my first extraction, so you can walk into that appointment with confidence instead of fear. Let's get into it. One, the injection was scarier than the extraction. Or so I thought. Let's be honest, nobody likes needles. The moment your dentist says, you'll just feel a little pinch, you're already preparing for battle. But here's what surprised me. The numbing injection usually lasts only a few seconds. After that, the area becomes completely numb. And once that anesthesia kicks in, you shouldn't feel pain during the extraction itself. Pressure? Absolutely. Pain? Ideally, no. If you ever do feel pain, tell your dentist immediately. Dentists actually want you comfortable. They're not trying to make you suffer. 2. You feel pressure, not pain. This one shocked me. Nobody told me I'd feel pushing, pulling, even a little cracking sound. And honestly, that's normal. Removing a tooth sometimes requires gently rocking it back and forth to widen the socket. That pressure can feel weird. Very weird. But weird doesn't mean painful. Think about moving furniture across the floor. There's movement, noise, pressure, but not necessarily pain. Knowing this beforehand would have saved me a lot of panic. 3. The crunching sound isn't your jaw breaking. Okay, let's talk about the elephant in the room, the sound. Yes, sometimes you'll hear crunching or cracking. And yes, it can be terrifying. Your brain instantly screams, "My jaw is broken." Relax. Most of the time, those sounds come from the tooth, the ligament holding it, or the surrounding bone flexing slightly, not your jaw snapping in half. It's completely expected during many extractions. Still weird, but completely normal. 4. The extraction is often faster than you expect. Here's another surprise. Many people imagine spending an hour fighting with the dentist. Reality? Once the tooth is numb and ready, simple extractions often take only a few minutes. Seriously, sometimes patients spend more time waiting for the anesthesia to work than the extraction itself. The anticipation is often longer than the procedure. 5. The hard part isn't always the extraction, it's the recovery. Here's where people make mistakes. They survive the extraction, then immediately do everything they're not supposed to do. Drinking through a straw, smoking, spitting repeatedly, rinsing aggressively, eating crunchy foods. All of these can dislodge the blood clot that forms inside the socket. And that blood clot is incredibly important. It's your body's natural bandage. Lose it, and you may develop something called dry socket. Trust me, that's a pain you definitely want to avoid. 6. Dry socket isn't common, but it's memorable. If you've ever searched tooth extraction online, you've probably seen horror stories about dry socket. People make it sound like it's guaranteed. It's not. Most extractions heal perfectly, but dry socket can happen if the protective clot is lost too early. The good news? Following your dentist's instructions dramatically lowers the risk. So don't treat those instructions like optional reading. They're your recovery cheat code. 7. Swelling doesn't mean something went wrong. Here's something that catches people off guard. You wake up the next morning. Your cheek looks like you lost a boxing match. Instant panic. But mild swelling is completely normal. In fact, swelling often peaks around the second or third day before it gradually improves. Cold packs during the first 24 hours can really help. So don't judge your recovery based on day 1. Healing takes time. 8. Eating becomes a strategy game. Nobody warned me that choosing food would suddenly become a challenge. Hot pizza? Probably not. Crunchy chips? Definitely not. Instead, think soft. Yogurt, mashed potatoes, soup that's warm, not boiling hot, scrambled eggs, smoothies without using a straw. Your mouth will thank you. And yes, this is probably the only time mashed potatoes become doctor's orders. 9. Healing isn't instant. Many people expect to feel completely normal after 2 days. Sometimes that happens. Sometimes it doesn't. The gum closes gradually. The bone underneath takes even longer. Just because the pain disappears doesn't mean the healing is finished. Your body is quietly rebuilding everything underneath the surface. Healing is a marathon, not a sprint. 10. Don't be a hero. This is probably the biggest lesson of all. If your dentist gives you pain medication, take it as directed. If they prescribe antibiotics, finish the course if instructed. If they tell you to avoid certain foods, actually avoid them. Don't test your luck by eating fried chicken 6 hours later. Your future self will appreciate your patience. If I could go back before my very first extraction, I'd tell myself one simple thing: you're going to be okay. The fear before the appointment is usually much worse than the appointment itself. Modern dentistry has come a long way. Dentists perform extractions every single day. The procedure is designed to keep you comfortable, and recovery is usually smooth when you follow instructions. So, if you've got an extraction coming up, take a deep breath, ask questions, trust your dentist, and remember, temporary discomfort can lead to long-term relief from pain, infection, or a damaged tooth. Sometimes, removing one tooth is exactly what allows the rest of your smile to stay healthy. If this video helped calm your nerves or taught you something you didn't know, hit that like button and subscribe for more easy-to-understand dental videos. And I want to hear from you. What's your biggest fear about getting a tooth extracted? Drop it in the comments, and I'll answer as many questions as I can. Until next time, keep smiling and take care of your teeth. See you in the next video.